Hey, it's Adam Sewell, MD. Today I'm going to share with you a powerful, evidence-supported supplement stack designed specifically to reduce insulin levels and improve insulin sensitivity. This protocol is perfect for patients with insulin resistance, type 2 diabetes, PCOS, metabolic syndrome, or those trying to reduce inflammation and improve cognitive performance by lowering insulin load, especially if we're looking at insulin as a central driver in chronic disease. Let's get straight into it. Berberine, 500 milligrams twice daily with meals. Berberine works like metformin. It activates AMPK, lowers fasting insulin, and improves glucose disposal. In one study published in the journal Metabolism, berberine was shown to decrease fasting blood insulin by 28.1% in type 2 diabetic patients. Clinical reference, Yin J. et al., 2008. Efficacy of berberine in patients with type 2 diabetes mellitus. Alpha lipoic acid, 300 to 600 milligrams daily. ALA is a mitochondrial antioxidant that improves insulin sensitivity, especially in muscle tissue. In a randomized placebo-controlled trial published in Diabetes Care, ALA improved insulin-stimulated glucose uptake in patients with type 2 diabetes. Clinical reference, Jacob S. et al., 1999. Oral administration of RAC alpha lipoic acid improves insulin sensitivity. Magnesium, 300 to 400 milligrams daily, preferably glycinate or citrate. Magnesium deficiency is common in insulin-resistant patients and is associated with impaired insulin signaling. A meta-analysis published in Diabetes Care found that higher magnesium intake reduced the risk of type 2 diabetes by 23%. Clinical reference, Dong J.Y. et al., 2011. Magnesium intake and risk of type 2 diabetes. Chromium Picolinate, 200 to 400 micrograms daily. Chromium enhances insulin receptor activity and improves glucose tolerance. In a double-blind trial published in Diabetes, chromium supplementation led to significant reductions in insulin levels and HbA1c in diabetic patients. Clinical reference, Anderson, R.A. et al., 1997. Chromium supplementation improves insulin sensitivity. Inositol, 2,000 milligrams, Myo-Inositol, plus 50 milligrams D-Chiro-Inositol. This is especially effective in women with PCOS and metabolic syndrome. It improves insulin signaling by restoring the inositol phosphoglycan second messenger pathway. A study in gynecological endocrinology showed significant improvements in insulin sensitivity and ovulation rates. Clinical reference, Genazzani, A.D. et al., 2008. Myo-Inositol administration positively affects hyperinsulinemia in PCOS. Apple cider vinegar, 1 to 2 tablespoons diluted in water before meals. ACV reduces the glycemic and insulinemic response to meals. In other words, you don't spike as hard after eating. A small but compelling study in Diabetes Care showed that vinegar ingestion before a high-carb meal significantly reduced insulin levels. Clinical reference, Johnston, C.S. et al. In 2004. Vinegar improves insulin sensitivity to a high carbohydrate meal in subjects with insulin resistance or type 2 diabetes. Omega-3 fatty acids, 1,000 to 2,000 milligrams combined EPA and DHA. Omega-3s reduce systemic inflammation and improve insulin receptor function. A randomized controlled trial published in Arquivos Brasileiros de Endocrinologia and Metabologia demonstrated that omega-3 supplementation improved insulin sensitivity and reduced non-esterified free fatty acid (NEFA) levels in patients with type 2 diabetes. Clinical reference, Farsi, P. et al., 2014. Effects of supplementation with omega-3 on insulin sensitivity and non-esterified free fatty acid (NEFA) in type 2 diabetic patients. Resveratrol, 100 to 250 milligrams daily, and curcumin, 500 to 1,000 milligrams daily with piperine. This duo downregulates pro-inflammatory pathways like nuclear factor kappa light chain enhancer of activated B cells and improves insulin signaling. In a study published in the Journal of Clinical Endocrinology and Metabolism, resveratrol significantly improved insulin sensitivity and reduced oxidative stress in type 2 diabetes. Clinical reference, Brasnio, P. et al., 2011. Resveratrol improves insulin sensitivity in type 2 diabetic patients. So here's your complete insulin-lowering stack, all backed by clinical research. Each one of these compounds works through a different mechanism. AMP-activated protein kinase activation, antioxidant effects, inflammation reduction, or direct insulin signaling modulation.